6 nurses who work inside the special COVID-19 unit at St. Joseph's Hospital in Syracuse are sounding the alarm tonight, saying they were diagnosed with the coronavirus after a policy change went into effect.
The hospital, though, has now reversed course and insists the nurses contracted the virus outside of the workplace. Lauren Khalil reports.
Some nurses at St. Joe's Hospital who spoke to us say they've been treating COVID-19 patients since March, and none of them got sick. But they say that changed when the hospital announced new procedures at the end of April. Since then, the nurses say 6 of their colleagues contracted COVID-19.
The nurses are unhappy, and we're willing to speak out about it because it's our lives and our families' lives that are on the line.
We're protecting the identity of one of the nurses because those who've complained to us fear retaliation. The nurses say the hospital told them it was no longer necessary to wear N95 masks and that surgical masks would suffice. They further blame a change in the hospital's airflow system at the end of April and believe it contributed to 6 of them getting sick.
They took down the negative pressure unit, which helps drop the particles from the air immediately to the floor so they're not suspended in the air. And they took away our N95s.
The nurses say the mood among them in the COVID unit has been angry as more of them test positive. Hospital leaders insist the majority of staff who contracted the virus did so in the community, not at work.
A couple things. Well, I don't want to talk about specific people who've contracted the virus. It's actually an epidemic, and the disease is everywhere, and people are at risk to contract it. That's not to say that there's no validity to anything anyone's saying, but nobody's specifically, I've been party to any of those conversations.
We started asking questions on Monday. On Tuesday, St. Joseph's confirms it's now reinstituting the negative pressure airflow throughout the COVID unit and has always taken personal protective equipment for staff seriously and done so according to guidance from national and state agencies. But the nurses see this as a cause and effect.
1 week later, we had our first positive. The day after that, we had our second positive. 2 days later, we had 4 positives. And then over the weekend, we had 2 more tests positive.
Another nurse who says she's tested positive and is recovering at home is upset that the hospital is so convinced the virus was contracted off the job. I'm not sure at what point I was exposed, she says, but I'm near next to positive it was from the hospital. As a nurse that works with COVID-positive patients, I felt it to be my duty to take the social distancing to the next level, having my husband run to the store instead of me, eating leftovers as much as possible, cooking at home.
6 nurses down, and that's 6 nurses too many, over a simple policy change that, it's more expensive, but the bottom line is we felt safe going to work.
This is hard work every single day. So it's easier to, the more we do it, it's easier to get frustrated with the conditions that we've been given. We want to make sure we're doing everything we can to help them. And we really feel like we have and do on an every single day basis.
Now, the 2 nurses that we've been in contact with say that there are other staff members who work in the COVID-19 unit who right now are waiting on test results. Hospital leaders and spokespeople tell us that the recent change back to negative pressure rooms was made in response to a state directive that has them preparing to take in more nursing home patients. It says that it went back to that negative pressure room to make the air droplets fall to the ground rather than spray out to accommodate any expected increase in those nursing home patients. In the studio, I'm Lauren Khalil.
An NBC3 follow-up for you tonight on a story we first broke yesterday. Some nurses at St. Joseph's Health Hospital say they were not getting the proper protective gear when treating COVID-19 patients after the hospital made a procedural change. Nurses say the move led to several healthcare workers testing positive for the virus. St. Joe's has reversed course on that procedural change, but we are learning Syracuse is not the only hospital run by Trinity where this decision was made. Tommy Sladak is live in Syracuse with the NBC3 follow-up. Tommy?
Yeah, Megan, nurses here at St. Joseph's who've reached out to us say they feel their safety concerns have been largely ignored by hospital owner Trinity Health. And today we learned they're not the only ones sounding the alarm. The Massachusetts Nurses Association says RNs at Trinity-owned Mercy Medical Center and Providence Behavioral Health Center have been forced to wear surgical masks or told to reuse one-time disposable PPE since early April. Some nurses at St. Joseph tell us of a similar experience and say 6 nurses have tested positive since the change in mask procedures. Nurses at St. Joseph's in Syracuse and at 2 facilities in Massachusetts say Trinity Health has not been providing N95 masks to those caring for positive and suspected COVID-19 patients.
It has never been okay, and we need to address this now.
Judy Perret is the director of nursing and labor with the Massachusetts Nurses Association. Since early April, Perret says RNs at Trinity-owned Mercy Medical Center and Providence Behavioral Health Center have been forced to wear surgical masks or told to reuse one-time disposable PPE. She compares it to giving a firefighter a bucket of water to put out a house fire.
There's a global shortage of PPE, but that does not make it right when we are putting our frontline nurses' health and safety in jeopardy. We've had nurses report being ill, testing positive themselves, and all they want to do is take care of their patients.
Some nurses at St. Joseph's tell us of a similar experience. Just yesterday, the hospital confirmed they've reinstituted the negative pressure airflow through the COVID-19 unit, used to help contain the spread of the virus. Perret says a COVID-19 unit should never operate without it. As for masks, St. Joseph says they've always taken PPE for staff seriously and followed guidance from health agencies. Perret says if nurses continue to not be provided N95s and proper PPE, she'll be concerned for what's to come.
As our nurses continue to experience the virus themselves, who is going to be left to take care of patients when we experience the second surge of this virus?
And in a statement to CNY Central this afternoon, Trinity Health says safety is a core value. They also say, quote, to be good stewards of our resources, we are employing well-established conservation strategies consistent with CDC guidelines. Reporting live outside St. Joseph's Health Hospital, I'm Tommy Slater.
Yeah, and Tommy, we received 3 or 4 contacts from nurses at the hospital today. They are very concerned.